Hi, so the three muscles I have chosen for my trigger point assignment would be the gastrocnemius, the hamstrings, and the quadratus lumborum. I chose these three because they all relate to um, leg tightness as well as lower back pain. So to start out, first we'll do the gastrocnemius. Um, the trigger point location is at the proximal, medial, and lateral border of the muscle, which is at the back of your leg here, in your calf, at the top of the muscle. So if you have someone else, you could use a ball or something like that to perform this trigger point assessment, but unfortunately I'm by myself. And I don't have a foam roller, but I do have this here container, which is very similar to a foam roller. So gotta use what you can. So for this trigger point assessment, you want to find the tender spots on the top of the muscle there, and gently just roll back and forth on the tight section of the muscle to kind of release the tension. Next, we have the hamstring muscle going up the leg. So this one is very common when it comes to really tight legs or lower back pain, but it's also something that's very easy to deal with when it comes to trigger point assessments. The trigger point for the hamstrings is right in the middle of the muscle belly, so this one doesn't take too much effort to find. Just wherever it feels tight, right in the middle of the muscle, that's where you want to put the ball or the foam roller. So again, find that tender spot in the middle of the muscle and then just roll back and forth until the tension is released. And then lastly, we have the quadratus lumborum. This guy is in your lower back. So this one's inferior to the erector spinae and lateral to the transverse process of the lumbar spine, which is in your back here. So it would be somewhere up in this area here. So not like right by your spine or the muscles right beside it, but slightly off to the side there. So again, this guy would cause a lot of lower back pain if it's quite tight or underused. So again, for this one, personally, I feel like a ball would be best. But for the foam rolling technique, again, just find that tender spot in your mid-back there, and you should feel that release of tension, and it'll kind of like radiate down into your butt muscles and stuff like that if you're doing it correctly. So again, find the tender point, lie down, and just kind of roll it out until the tension is gone.